out of many, one. It really is a breathtaking mission statement when you recognize that it's not just about the nation that Charles Thompson helped form more than 230 years ago. It is about the nation we have become and will become. It is about the choices we can make as organized groups and individuals. It's about being free. So go up to the Capitol today to exercise your freedom. Share a fact or two about your community hospital. Share an opinion or two about how your legislator can help support your local hospital. And revel in the understanding that these are the simple acts that have been executed for over 2 centuries that make our democracy work. Have a great day. Thanks again for coming.
When Iowa holds its presidential caucuses, Steffen Schmidt gets almost as much attention as some of the candidates. He has appeared on a live CNN broadcast from the campus of Iowa State University, bantering with hosts Paul Begala and Tucker Carlson, as well as on BBC, National Public Radio, CNBC, and in the Chicago Tribune, USA Today, the Christian Science Monitor, and Washington Post. Professor Schmidt can be heard as Dr. Politics on Iowa Public Radio and is a graduate of Columbia University, where he earned his Ph.D. in Public Law and Government. Schmidt is co-author of the best-selling American Government College textbook, American Government and Politics Today. Please welcome today's keynote speaker, Dr. Politics, Steffen Schmidt.
Well, thank you, folks. It's a great pleasure to be here, and I'm always honored when I get invited to speak with Iowans, and especially folks like you who dedicate so much of your time to an important cause and important issues. I'm going to talk very briefly about, let me tell you what I wrote a couple of minutes ago. I said, what I share with you today are the perceptions about health care and health insurance in this complicated e pluribus unum country and state. I didn't have e pluribus unum in there before Ken started talking about it. Kirk, I'm sorry, but I added that. I also want you to know that they may not be my opinions or my prescriptions for healthcare reform. The opinions expressed here may not be those of this station, its management, this organization, or even this guest. I am the bearer of some good and some bad news, but I take no credit for any of it because I'm simply a transmission to you of what is going on. I just finished my radio show on Iowa Public Radio at 10 to 11 down the street here in their studio. The entire show today, we do it every Wednesday at 10 o'clock, 640 on your AM dial, or streaming live on the internet at iowapublicradio.org, was on healthcare, health reform. The summit meeting that is going to take place between President Obama and Republicans. I urge you to look at today's New York Times, which I have here. The front page of it has 2 interesting stories about that meeting, which is a kind of interesting phenomenon after an entire year of discussing health care, health insurance, health reform, the costs of health care, and we now are waiting to see what emerges from this particular meeting. And what was interesting was that there was actually a lot of skepticism that this is really about health care and health reform and insurance. There were a lot of people who said this is really about politics. And it is, to me at least, both fascinating and also to some extent tragic that something as important as health care, which is something that no one can live without, should have become so politicized that we are now very cynical about how to address it in the political arena. I think the Iowa legislature is a much better venue People know each other, respect each other more, are more respectful to each other. You're closer to them, and it's wonderful to know that citizen participants in the United States, such as you, are willing to take out the time from your busy lives to try and shape public policy. If we could do this in Washington, D.C., healthcare reform would have taken a completely different direction and shape. We would have had a more serious discussion than what has happened. I'm not going to bore you with too many numbers, so I'll skip through those because I know that you're familiar with them. By 2050, just simply paying interest on the national debt would consume more than half of the annual revenues of the federal government, and those three, Medicare, Social Security, and Medicaid, are growing much faster than the economy. And as the economy fails to grow fast enough, the percentage of those increases geometrically. There's an article today in the business section of the New York Times, and one of my former students, Steve Wood, at Iowa State, is now the chief market strategist for Russell Investments, said that the economy isn't really dead and consumers are damaged but not dead. He said things are not deteriorating, but they're not really measurably improving in terms of especially housing and jobs. And as that happens, you all know how that reverberates into things such as healthcare and health insurance. So the economy on one end of this is a crucial factor, as you all know, and we need to keep our eye on that. Eliminating the fiscal gap through 2050 would require tax increases right now or program cuts that would be about 3.2% of the total wealth of the United States, all the way through 2050. You notice I have an obsession with the 2050. It would be politically impossible, and it would be not a very good idea to attempt to do that and to increase taxes by 18% and reduce all programs by 15%, including Social Security, Medicare, defense, anti-terrorism, education, veterans benefits, and so on, would be an incredible trauma on American society, and it would certainly affect, as you know, the healthcare system. We are faced with the necessity of having both sides, the revenue and the expenditure side of the budget, on the table when we talk about how we are going to address this issue. And unfortunately, on the revenue side, we have become a country that is reluctant to deal with revenue, to raising more funds and finding more ways of financing things. And on the expenditure side, in health care, we are struggling with ethical issues and moral issues, and as well as political issues, because we rarely want to talk about how we are going to ration health care. We rarely talk about how we are going to essentially deny health care at some point or reduce health care at some point in people's lives, because we just can't seem to address that from a moral perspective. And that is a challenge, as you know, because as this country gets older, and I'm getting older by the day, we are facing those things as we get older, and we are having real problems in sorting them out as issues that we can basically deal with. So there are organizations, Imagine 2050 is a blog that talks about this. It seems like 2050 is a long ways off. I know that you folks have to be back at the State House at 1 o'clock. That's more realistic in terms of a time frame. But 2050 for healthcare, for reform, for how to rebuild the American economy, and how to wrestle down this massive deficit that we have, it really isn't that far off. When I came to Iowa State in 1970, I thought that 2010 was way off, and I didn't even know where I would be. I'm fortunate to have been at Iowa State for 40 years, and I'm really thrilled that I am in Des Moines, Iowa today in 2010, but it seemed very far off. Well, 2050 is coming pretty soon, and I think we can at least begin to talk about how we are going to move in the short term, but also how we are going to move in the long run. Obviously, we have a real deep and very trying conflict between public and private solutions. I would say when someone asks me, and I do a lot of media, I don't know who has that voice that announces in here, but I want that voice. That's the most fabulous voice, and you heard that I do a lot of media. I did the New York Daily News yesterday, very long interview on healthcare reform, on whether the White House meeting is going to accomplish something. And the problem is that we have this really deep conflict between private and public solutions, between looking at healthcare as a public good, as something that American society owes to every American to some degree, and at the same time, the fact that we are a capitalist country, that the prosperity of this country has been driven by the fact that people create organizations and institutions, companies, laboratories, hospitals, care facilities, and then make them commercially viable through good business practices. And when it comes to the cost of healthcare reform, the funding of how to deliver healthcare, we are really at this point struggling with how to separate out this idea of healthcare as a public good and healthcare as a commercial product. And no wonder this debate is so very difficult. I'm not going to show you little video clips that I have simply to save some time, but I have a little video clip of the Heritage Foundation, which is very, very business model driven and says public health, that's something we can talk about, but basically the United States is a capitalist country. We want private solutions and we want the private sector to be able to do this. And then, of course, there's the opposite argument, which is that health care costs and health insurance costs and costs of Medicare and costs of veterans' health care and the costs of Medicaid are bankrupting us. They are slowly driving states to shift more and more of their revenue and their spending to that sector away from other things. And I don't know about you, but I need some asphalt in those potholes in Nevada. I have a big SUV, but the wheels just aren't big enough to take some of those. So we have these conflicting interests, and when you go to the State House, you'll feel that anxiety among legislators between health care and that important value that we have, that necessity that we have, and those other pressures that are coming. I'm in the State House frequently, and every few days now, as we come to the zenith of the session, there are other interests in the State House with exhibits, with T-shirts on, with their name tags, shaking the hands of Rod Roberts and others and saying, we want to tell you why you need to listen to us. Ours is the most important issue for the state legislature this year, and that can be labor issues or education or other things. And so there are these competing interests that are so difficult because, of course, I know and you know that health care is the most important one. And if there is any extra money, it ought to be diverted to health care, right? Don't we know that? Yeah. I mean, next week when I give a talk to the teachers of Iowa Association, it might not be healthcare anymore, because I do tailor my comments to the audience. But healthcare certainly is important, and you have a very, very good case to make. I have a little list here of those things that are important that you should remember when you go back again this afternoon to talk to folks, and that is we have multiple players. Those players are all very important in helping us to find solutions, but they're often very conflicting players in the discussion over healthcare reform. And you can see that you know what they are. I mean, the insurance companies and some of the best in the world are down the street from here, and are growing and prospering and are the pride of Iowa as the second largest, and Des Moines as the second largest insurance center in the United States. You have the healthcare industry, you have public opinion, and there you have a conflict between those who are insured and not insured, and you know that. The reason why this Obamacare and the whole healthcare debate has been so passionate and has been so difficult is because if you have something, the fear of losing it is much greater than any promises about betterment in the future. And a lot of Americans have good access to health care, have health insurance, and can afford it in one form or another, and feel very threatened by all of the discussions about how to essentially bring change. You notice President Obama has decided to now move away from the word change. This week, the president decided that it's not so much about change, which sounds more threatening. It's really about reform. It's really about fixing. It's about tweaking, making little things happen. Because really what happened was when you talk about major change, you are disrupting people's lives and making people nervous about what that all means. And I know that all of you are very wise and savvy, and my friends back there in the news media are very important because very often on an issue such as this, it is very difficult to understand what all this means. There's a lot of neat stuff around in the internet, and this was a kind of a sarcastic little poster. Universal health care for all citizens? Don't be silly. That kind of thing is only for every other industrialized nation. We're in the business of war, not welfare. Well, you know, you can find all kinds of messages out there, but certainly the comparison of the United States to other countries is important. I think this is a problem, complexity. Some of you may not be able to see these slides, so I'm sorry I'm actually repeating these by word. I don't really think anybody understands the full complexity of the healthcare and health insurance system in the United States. And I apologize to you because you are experts on it. This is your whole life. Some of you are distinguished, nationally known individuals. I still don't think you know everything there is to know about healthcare and health reform because it's too complicated. It is like taxes. Wilbur Mills was the only member of Congress who ever really understood the American tax law. Then he fell into the basin with a stripper in Washington, D.C. and discredited himself. But he did you remember that, Wilbur Mills? He was great. But he did understand the U.S. tax code. He was the go-to guy. I don't think there is any go-to guy or woman in the United States for health care. It is simply too complicated and intertwined with too many other values. You know, should the military and veterans have their own health care system, or should the Veterans Administration be blended in and done away with? What about Medicare? What about Medicaid? How big should the role of government be? Should individuals, a guy called this morning to the show and said, we should do away with everything. Everything. Do away with all of that, and we would have the whole healthcare problem solved. Why? He said, because you'd go in to see your doctor, and your doctor says, well, you know, let's do an MRI, and let's do a CAT scan, and let's do these tests, and you go, how much is that going to cost me? Well, it'll be about $8,000, $9,000. I don't want that. Do you have anything cheaper that you can do for me? And the whole point was, if it wasn't paid for by insurance, Medicare, Medicaid, or the Veterans Administration or someone else, the cost factor would go away. People had to write their own checks and pay by cash or with their Visa card. We would have it all under control. Well, that seems nice idea. Ain't gonna work. Most healthcare today requires the pooling of risk. We have car insurance. Wouldn't it be nice if we didn't have to pay car insurance or house insurance on our homes? You know, every year you get these bills. You know, if your house burns down, build another one, write a check for it, you know? Well, no, we pool our risks. We put together healthy people and sick people and old people and young people, liberals, Democrats, Republicans, conservatives, all of the pluribus unum people, we put them all together in a group, and they all contribute some money, and then when one of them gets sick, we take out of that pool to pay for it. You know, if we don't have that, then we all become predators. We are all out there, and the ones who have a checkbook and a credit card can go in and get their health care, and they'll say, yeah, give me a couple of MRIs at least, you know, what the heck, because I can afford it. And the ones who can't afford it are not going to get health care. And it seems to me a lot of people don't understand that. So complexity is a really big problem. This is by a neuroscientist, by the way, who paints, and all of his paintings are about complexity. And I guess I thought I would use, with his permission, that particular picture because that's a big problem. 60% of US firms offer health benefits to any of their workers, and I say only 60% because the rest then have to be cared for in other ways. And you know that premiums are going up, and they're at $13,375 a year, except the rates are going up very quickly, much more quickly. And this is the new Kaiser Family Foundation report that you probably have seen, or you can Google it on the internet. Healthcare is up 131%, wages 38%, and inflation 28%. So costs are rising very quickly. Problems with having employer-based insurance is discrimination against older workers. You know about this company where one employer hired a person who was 40 years of age, and they immediately raised the rates because it was an older person, 40 years. I wish I was 40. I don't think that's old age. It's discouraging firms from offering health care insurance, and it forces employers to think twice about hiring new workers. So it's not very good, and deductibles are going up at small firms from 3 to 199 workers. 40% of them face deductibles of 1,000 or other basically rising expenses. And this is a chart that you've probably all seen going up to 2020. I couldn't find one for 2050. We just can't project that far. But you know, it's too unstable an environment. You can see it begins with 1999, 11% of the median family, and then it keeps going up until 2020. It's almost up to 25%. 25% of families' income for insurance premiums. So that is troublesome. We know that Medicare is a problem, and the millions of seniors who signed up for private health care plans through Medicare are now facing extremely high increases in premiums. And the Medicare population, of course, well, some of us, I see some other folks my age and a little bit older, and those of you who are the baby boomers, 70 million in 2025, rising from 40 to 70 million. How are we going to manage Medicare when everybody is eligible? Well, almost a third of Americans are eligible, and that is a real problem. Low-income elderly women in poor health now spend about 52% of their income for out-of-pocket health care, and imagine it's going to go up to 72% by 2020. Well, you can't spend 72% out of pocket for something. What are you going to do for rent and other things? So really serious problems. Not going to talk too much about the Commonwealth Fund report, but it's a very good one. It says we need to cover the uninsured, enhance affordability of insurance coverage, and control the rise of healthcare costs, which is not much of an issue, but achieving the first goal without the second and third, you can't do that. You have to cover the uninsured. We have to have something like that, and we have to slow insurance costs as well. If you get a chance, talk to Jack Hatch. Good guy. Don't agree with everything he does. One of my students, of course. And Jack, I have a little interview here which I won't play. You can go see it at insideriowa.com. I left some cards up on that table. I don't know if you all got those or not, but it's a new internet magazine that I started with Stan Brewer. And the interview with Jack Hatch is there, so you can go watch it there. It's a little digital video. But we are talking about healthcare insurance in the U.S. We should have talked about healthcare reform long ago. Actually, we did. Yeah, we did. This chart is Nixon, Carter, and Clinton. If Nixon had been able to put together with Ted Kennedy a healthcare reform of some sort, the rise in the cost of healthcare as a percentage of the economy would have only been that purple line. That's the Nixon line, because it would have fixed some things that drove up prices. You see 10.7% there. Well, if it didn't happen, all right? What if Jimmy Carter had managed to get some healthcare reform? Well, then it would have slowed down and flattened out to 11.5%. Well, it didn't happen. Well, what if Clinton had managed with Congress to put through some sensible healthcare? Well, it didn't happen. So it went up to 14.2%. Well, what if Bush or Obama were able to get it through? Well, it's getting late. It's getting late, because we have dug ourselves into a hole. We want to avoid health care reform. We try, but it's so political, we can't get it done. And if we can't get it done this time, that curve of costs there, as you can see, is going to keep going up, and the expenses are going to keep rising. So the federal government would have been a big beneficiary if we had gotten regular health care reform, normally done, sensible, good stuff, and instead of consuming 6.2% of the GDP in 2010, federal outlays would have been about 3.7%. And Nixon's reforms would have helped, and others as well. Causes of rising costs, let's not get into all that. You know what that is. Government paperwork, new technology, high insurance company profits, malpractice, fraud, and so on. This is the cartoon that says, this is a healthy profits insurance company. Are you crazy? A government healthcare system would be a bureaucratic nightmare, and that's the owner of the company. And you can see the bureaucratic nightmare of all these little computers saying no, no, no. That's obviously a cartoon by someone who is critical of the health industry. And I apologize to those of you who are in that industry. We have an aging population. I have already told you that. And you looked in the mirror this morning and realized that anyway. And so here's what we've got. You know, we are at 2010, 40.2% of people in the U.S. 65 or over. Shift over to the last bar chart in 2030, and we're going to have large numbers. And that's, that's 40.2 million, and it'll be 72.1 million over 65 in 2030. And this is the chart that shows you as you get older, as the age increases, how much healthcare, per capita healthcare spending increases. You can see those of you who are 75 or over there at the very end are costing a lot of money to yourselves and to the rest of society. Aging just simply costs a lot of money. We have obesity, and we have very bad problems in the United States with healthy food and healthy habits, exercise, and so on. And these are some of my favorite pictures that I use in my American government class, because immediately you see the students put away their chocolate bars and put the caps on their pop and so on. 2009 poll, 72% of Americans are worried that if someone in their family becomes seriously ill, their health insurance may not cover the medical bills. 47% is very worried about inadequate health care coverage. 65% worry that if they lose or change their job, they might lose their health insurance. 60% say they worry that if someone in their family becomes seriously ill, their health insurance might drop the coverage. 56% worry that if they lose or change jobs, they may not be able to afford health insurance. Those are important polls. This is a poll from Nevada just from this last week. 34% support the current Senate bill. 32% of independents support the current Senate bill, which is not current anymore, really. 58% support a public option. 61% of independents support a public option in Nevada. and 55% support reconciliation on health care, and 64% of independents support reconciliation. I know, politicians, they always talk in their own little language. Why don't they just use normal words? What's reconciliation, Well, reconciliation is that instead of passing a whole bill, you go, well, we're just going to take all these little pieces and vote on them. You don't have to have 60 votes in the Senate to stop a filibuster, because with reconciliation, you can pass all kinds of little pieces as long as you have a majority. I think, I'll be honest with you, I think President Obama is going to grab the Democrats, smack them across the head, and say, start passing reconciliation health reform now. And the Democrats, until 2010, are going to have a majority in the House and Senate to pass all kinds of legislation at the federal level. After 2010, when the Republicans take over the House and Senate, then the Republicans will have to figure out how to do health. Oh, did I say that? I'm sorry. My D friends don't like me to say that, but I have a crystal ball, so that's why I'm called Dr. Politics. Confusion, look at this. Americans began favoring health reform. You see the black line, and very few of them opposed it. More and more opposed it as they saw the process happening. Fewer and fewer supported, so that now 51% oppose the health care plan as if there were one. And one reason is that there has been so much confusion, and also media hype, death panels, Obamacare, big government, all kinds of discussions, and real risks that Medicare and other programs are going to be tampered with. So there has been a change, even though the other polls show that Americans would like something done about healthcare reform. You know about the rising costs in Iowa and other places. Did you know that there is an alternative cost containment method for healthcare? Yes, there is. This is from my latest issue of, I guess, Business Week. It's not called Bloomberg's Business Week. The private sector solution to healthcare reform, if nothing else happens, is that the big lizards go out and eat up all the little lizards. The big companies go and buy up and swallow and incorporate all the little insurance companies. Why would that be a cost reduction and contain management strategy? Because by eating up all the little companies, you spread your risk, and you essentially end up with a larger business model from which you can then work, and it would allow companies to regulate the delivery of healthcare and essentially deal with it. It's a big business, $2.5 trillion in 2009 U.S. healthcare spending. I saw the figures for Iowa, and you folks really contribute to the economy of the state, a lot of jobs, a lot of wonderful services. And if we don't do something, there will be a lot of large companies buying up little companies. So I think I was at the State House last week. Was this last week? Anybody remember? Do you know what this was? Anybody? Who was there at this? And nobody here was there? Wow, interesting. Well, there are lots of people at the State House, I tell you, and they're there pushing for health care discussions and other things. And as I said, it is a scary process, and it is incomprehensible to a lot of people. And I guess I would end by simply saying that I think Kirk Norris already said this in a different way, that you are the very best messengers, both to the legislature and to the public, to help clarify and also to help to dispel some of the confusion that exists. You are, because you understand it. So when you leave here, I'm 5 minutes over, I'm done. You will get on the buses, I think, and go there, and you really know what you're talking about. And the legislature needs to hear from people like you, but also talk to the media. Go find some Des Moines Register reporter. Go find somebody who's got a big, huge, not one of those little video camcorders like Stan Brewer has. By the way, we're going to have a little bit of this on InsiderIowa.com. On our magazine, a little bit of my talk. So if you were asleep because of the heavy dessert, you can go there and watch part of it again. I think there was a heavy dessert. I didn't get any, but there was no dessert. Oh, cheap organization. All right. I think you are the very best messengers to the legislature, and they want to know, and the media wants to know, and the public wants to know. So please go there and explain to them how this works, why we have to do some interesting new things. And your organization, of course, is fantastic, and I congratulate you for all your work. And you are providing the answers that are not coming from Washington, D.C., and that is why not only are we e pluribus unum, but as a federal system, we have the wonderful opportunity to not wait for Washington to do things. We are a country where we can solve problems at all kinds of different levels, and this is a very big one, and let's start solving it at this level. Thank you very much. I appreciate it.
Now, please welcome IHA Senior Vice President, Mr. Greg Botenhammer.
Good afternoon. Please join me in another round of applause for Professor Schmidt. I think it's very appropriate that we have Dr. Politics here with us today, given your role in our advocacy efforts. But I thought this afternoon maybe we should start with a basic understanding of the word politics. By breaking the word down in Greek, we know that poly means the art of government. And tics, well, you all know what tics are. From the Greek, that means those who are elected. But in all deference to our legislators in the room, I actually thought that up before I knew you were going to be here. As a lobbyist, there's very few groups of individuals I can make fun of, so forgive me for that. In all seriousness, Iowa's elected officials are well-meaning individuals. They're your friends and your neighbors. They attend your local church. Their children and grandchildren attend the same schools that your family has, sometimes for generations. They sacrifice much to serve your communities. They're all good Iowans. But in the hubbub of the Iowa General Assembly, sometimes they can get distracted. They can forget some of the true pillars of their communities, like their local hospital. And that's why it's so important that you're here today to remind them of that reality. I'd like to just pause for a moment and share with you a brief television commercial sponsored by the Iowa Hospital Association this spring that we hope draws some of this attention to the central role your hospital plays in your hometown. I'd like to play that now.
This is your Iowa hospital, a place for curing and caring, the home of helpers and heroes, centers of excellence, a magnet for growth, a symbol of hope, a light in the dark that never goes out. This is your Iowa hospital, the Iowa Hospital Association. We care about Iowa's health.
Thank you. I hope many of you have had the opportunity to see that. It's running on television stations all across the state. Today you're here to share the message about access to health care for our citizens, particularly our most vulnerable citizens. As the national discussion on health care reform continues to drag out, we in Iowa remain blessed. We have, by most accounts, one of the top 2 or 3 overall health care systems in the United States. We have one of the highest rates of insured citizens of any state in the nation. And your hospitals provide some of the highest quality care at some of the lowest costs that can be found anywhere. Yet you might hear from legislators today that health care costs are too high and that hospitals are part of the problem. But has anyone here heard that Iowa gets one of the lowest Medicare reimbursements of any state in the country? A few hands have heard that. And do you know that Iowa's own Medicaid program, the state's insurance program for the poor, pays hospitals even less? The reality is that your hospital is expected to perform miracles every day when payments are continually being reduced. such as in December of last year when the governor initiated a 5% Medicaid reduction for hospitals and physicians. This caused a loss of more than $18 million in state and federal money for Iowa hospitals. And now with the Iowa General Assembly faced with even greater budget difficulties, recent Health and Human Service budget targets call for an additional $172 million in reductions, which certainly does not bode well for Iowa hospitals. The Iowa Hospital Association has stepped up to the plate to help. The IHA board has endorsed a 3-year plan to assess our largest hospitals $40 million to act as a state share of Medicaid to match federal funds. These dollars would then be used both to increase hospital Medicaid payments and to provide $65 million of state and federal funds to support Iowa's Medicaid program. Now, I know it's a little complicated and it's not easy to follow, but it's a plan that other states have used and one that the federal government approves. It's a way that hospitals are willing to help the state on a short-term basis. It's not a tax increase, and it doesn't impact patient bills at all. But it's a way hospitals are willing to help the state in these challenging budgeting times. Today, we need to tell your legislators to support the IHA proposal and to oppose any other changes to that concept. There's one other issue that I want to bring to your attention today. Bills in the House and the Senate would provide some due process protections for well-meaning caregivers who are placed on the Dependent Adult Abuse Registry by the Department of Inspections and Appeals. Currently, when DIA conducts an investigation, the agency doesn't have to tell the hospital or the individual that they're even suspected of adult abuse. And they cite people for things like simple administrative mistakes or attending to other patients in an emergency as abuse situations. There are no protections or hearings in such cases, and people have sometimes lost their jobs and even their careers needlessly. Now, no one supports true dependent adult abuse, but this is an issue that needs addressing to protect hospital employees from a rogue government agency. Please ask your legislators today to support Senate File 2333 and House File 2154 to ensure that all hospital workers have the right to appropriate counsel in these circumstances. So you have your message today has 4 points. First, Iowa must sustain its Medicaid program, including appropriate payment levels to healthcare providers. Second, Medicaid cuts mean a real loss of jobs in your community. Third, the Iowa General Assembly should support the proposal put forth by the Iowa Hospital Association to assist in this regard. And fourth, the General Assembly should protect individual rights in abuse investigations. Now, at your plates today, you have some talking points on a sheet of paper to help guide you in your discussions. They talk about the hospital assessment plan and both the bills related to the Department of Inspections and Appeals. Importantly, take your pens out and mark off the last bullet point. That's a mistake from last year, and those bills don't exist. Makes your job just that much easier. We've put a blank for your legislator's name on there, and we hope that as you visit with your legislators, you'll put their name there and any notes on the back of this sheet that you care to leave us with in terms of information, and drop them off at the IHA information desk, which will be on the second floor at the Capitol. But the most important thing for you to leave in the mind of your legislator today is that your hospital is a vital healthcare and economic force in your community. You represent an essential part of the fabric of life that is Iowa. Hospitals make a difference in the lives of your fellow citizens every day. The Des Moines Register recently called hospitals one of the most influential and powerful lobbying groups in Iowa. That's only true because of the dedication of some 74,000 hospital employees who serve their communities every day. It's only true because people like you come out to the IHA Legislative Day every year to share your stories with your elected officials. You are the voice of Iowa hospitals, and we thank you for being here today. Now, when we break in a few moments, those of you who came in buses will exit on the south side of the convention center. Those of you who need rides to the Capitol can catch the IHA buses on the north exit. And when referencing those talking points, as I mentioned a minute ago, if you have a red circle on your talking points, you may redeem that at the table in the back to win one of the IHA coffee mugs that we're handing out today. So if you have a red circle, make sure you stop by we have a winner. Yeah, okay, we had a winner over there. And finally, we do have the tradition of drawing the name of the individual who will receive the flag that was discussed earlier that was flown over the U.S. Capitol. So Mark, would you come up and draw a name out of this box for us? Our winner is Robert Cates from Mason City, Iowa, from Mercy North, Iowa. And Mr. Cates, when we're finished, if you'll come up here, I have the flag and a certificate that we'd like to present to you. So thanks again to everyone today. We appreciate your efforts. You're making a huge difference. Have a great day at the Iowa Capitol.